But at that point, I'm going to hand over to you, Matt, to continue with the presentation.
Perfect. Thanks very much. Hi, everyone. Thanks for joining us today. So I'll just share my screen. Can you see that?
Yep, that's come up.
Perfect. Okay, so I'm Matt Sweeney. I'm Product and Operations Director at Redmore. If you haven't heard about what we do, we provide digital and transformation consultancy support into primary care. We work with PCNs, practices, and ICBs, and AI is a particularly hot topic at the moment. So in discussions with a lot of ICBs around what they're doing around their AI strategy. And so we want to put together a bit of a webinar today, and we're going to be covering a few areas. So we're going to be looking at what do we mean by AI in primary care? What are the different use cases that are happening, and what sort of solutions are available? We're then going to look at some sort of key risks that ICBs need to consider when they're implementing and adopting an AI strategy, the sort of components that they need to think about when they're developing the strategy, and also some suggested items that to include in a checklist when you're building it out. So in terms of what we do at Redmore, we really are a supportive function. So we'd work side by side with your teams in ICBs to sort of develop these programs. So one area that I think is getting a lot of interest in terms of AI is triage. So online consultations are well embedded now across primary care, and the next generation of these is going to be melding the online consultation data with the patient record itself so that AIs can intelligently route patients to the right route. So there's a few solutions out there that have already been trialed and piloted that are getting really impressive results. So the likes of Rapid Health and Ada are already doing studies. One study has shown that they've been able to produce reductions in patient waiting times of over 70% and showing significantly fewer repeat appointments. Just last week, the Tony Blair Institute released a study and a paper where they've recommended the NHS to look at rolling out nationally AI triage, and they believe it can show savings around £340 million a year for the NHS. And also improve patient experience too. And that could apply not just to primary care, but also the 111 entry route as well. So I think this is going to be an increasingly hot topic over the next year or so. There's also diagnostics as well. So on the left, I've got a screenshot from a story in the Times from last week that did a write-up on a study that Chelsea and Westminster Hospital did with skin analytics, where they're able to diagnose skin cancer just using images that they take in a smartphone, and they got a 99.9% success rate. And this is also being applied in some primary care settings where GPs are able to really fast track that diagnostic approach to skin cancer. But it's being applied in lots of different pathways as well. So there's also diagnostics where AI is helping around wound care with UTI diagnosis and other things like that. Clinical documentation and admin automation. So I think this is a particularly hot topic at the moment. So with ambient scribes, the likes of Hardy Health with Tortoise, they're really taking off across the NHS and providing really compelling results. So in some trials, they've been able to show reduced documentation time of 70% and able to save clinical time of 100 hours in 14 weeks in a recent study. RPA is similarly showing great results. So there's a recent study with Modality Partnership where they showed 72% of staff time was saved on prescription processing, helping to free up resources of patient care. And also Microsoft Copilot. So you may be aware that Microsoft had developed an AI offering on top of the Microsoft Office suite. So that can really speed up sort of admin automation as well. So these are all being trialed across different areas and showing really compelling results. We've also got predictive analytics. So a key part of the upcoming 10-year plan is going to be that move from sickness to prevention and encouraging primary care to adopt a more population health management approach. And AI predictive analytics, I think, is really going to be key to getting the most out of this. And there's lots of different solutions out there that are sort of providing predictive analytics for specific pathways and use cases, whether that's respiratory care or predicting falls for patients in care homes and things like that. And again, there's some really interesting studies where good results are coming out. And the NHS are actually looking into developing a framework to support the procurement of these as well. Another area is custom GPTs. So you may be aware that there's functionality of ChatGPT enables you to develop something called a custom GPT. And essentially, you're combining the functionality of ChatGPT with custom knowledge bases that may be stored at a local level. So we did a hackathon within Redmore last year, where we got a bunch of clinicians together and also other stakeholders across primary care to sort of brainstorm and come up with their own GPTs. And this is happening in pockets across the country. There's lots of AI hackathons that are going on, and these solutions are being used right now. So some examples of what we came up with in that session. One was something called GP Oracle. That supported when new GPs get onboarded within an area. So this would upload the knowledge base from Teams chats. So you can look at referral and prescribing data that on a local level, upload that into ChatGPT, and then new GPs that are getting onboarded can interrogate that to get that local intel. You can also use custom GPTs to sort of optimize the SMS messages that you're sending to patients. So you can reduce fragments and make sure that the messaging using in text is patient friendly. Other GPTs include compliance officer, so being able to use it to review regulatory compliance in the NHS, educational resources for things like frailty. So the potential of these is massive. It really is up to the creativity and the person with the idea to develop something. And lots of these have really good, can be really useful and have really good use cases. There's also some interesting studies that are going on right now around sort of the benefits of using LLMs to support diagnosis. This is a bit more controversial and more studies need to happen, but I just wanted to highlight this interesting study that came out last year from Cornell University. So they compared clinicians that didn't use any sort of LLM, so large language model, to support their diagnosis, and then they compared it with clinicians that did use it and compared their accuracy. So they actually found that clinicians that used a large language model to perform the diagnosis actually outperformed the clinicians that didn't use it. And then interestingly, the large language model itself actually was more outperformed the clinicians that even use the LLM, which is quite interesting. So more studies are happening here, but the models are getting better every month. So you can see the direction of travel is, using AI is really going to be a cornerstone of the best patient care you can offer in future. So it's no longer a future concept. It's here, across all these different use cases, AI is really transforming. It's saving time for the NHS. It's producing patient benefits. So I think it's an area that ICBs really need to be looking at, whether it's triage, documentation, diagnostics, predictive health, and more. So this is a recent communication that's come from NHS England to ICBs. So ICBs are in a bit of a tricky situation because if you're going to be funding RPA and AI products to primary care, the risk is really sitting with you guys as an ICB at the moment. So, it's a big responsibility. And there's lots of things that you need to consider as well. So, if you're considering an AI rollout approach, you need to be looking at what use case do we need to prioritize. There's lots of different areas that you can be looking at. What do you want to focus on in terms of providing the most bang for the buck and the most impact for your primary care organizations? There's also the responsibility to educate practice teams on the appropriate use of AI as well. So AIs can hallucinate, they can produce inaccurate results, and being able to understand how you need to use it is really key. And also helping practices navigate the regulatory burden of adopting AI solutions is really key. So you may have seen in that previous email I shared, there's an issue with RPA products being used with System 1, for instance, because of the way that they interface with the clinical system. And if practices aren't aware of that, they can get potential legal implications that's tricky for them. So in terms of that education and promotion of practices and when to use AI confidently and what they need to be steer of, what regulatory guidance they need to include is really important. And then the effective management of pilots, so you're actually tracking the right things, you're actually, really validating that the AI solution is providing bang for the buck, it's providing patient benefits is really key. And then it's the ongoing sustainability from there. And there's lots of different regulations that organisations need to consider. when implementing AI. And this ranges from the responsibilities that suppliers have themselves, whether it's making sure that they have got DTAC, they've got DSPT, they've got the relevant DCB 0129, assurance that if they're providing decision support, that they've registered as a medical device, all the way to the responsibilities with the GP practice themselves, make sure they've got a DPIA to know how to do a DPI effectively for AI solutions. All these things need to be considered. And I suppose an extra tricky thing for ICBs at the moment is the cart has maybe gone before the horse. So you may actually find that a lot of practices have already started adopting AI solutions. So you need to actually get an understanding of what's going on now so that you can then provide the right guidance for future, but also for the solutions that are already in place. So lots of risk there, and it could be quite overwhelming, and you may be tempted as an ICB to put things on pause with all that in mind. So I just wanted to include this slide really to offset that, because there's a natural sort of human cognitive bias that we have called omission bias, where basically we as humans, we judge harmful actions as worse than harmful inactions. So in the context of AI, it may seem safer with all these risks just to put things on pause for a while and get your ducks in a row. But the flip side of that is, you saw at the beginning of the presentation, all these benefits that are coming from AI now, all these pilots and trials that have showed that we can save the NHS lots of money, that we can improve patient care through introducing these interventions. So we can't forget about the cost of not introducing these amazing, tremendous benefits of introducing AI. So I would implore you, as leaders, to recognise that balance and seeing that actually there's massive opportunity with AI. So I think it's really important that we look at introducing AI strategies as quickly as we can. So Chris mentioned at the beginning that we're going to be doing a poll. So we've got something called Menti. So we could, we've got a QR code there. So you can either go on the website or just use that QR code. And we just got a question for you if you can answer. And then we'll look at the answers at the end when we do the Q&A session. But I'll just give you a minute so you can answer. How do you rate your ICB's current AI readiness?
So that question is now open, Matt. And also just remember, we've got another question for you coming up very shortly. So keep the screen open or keep your phone handy.
Great, thank you.
We have got a couple of answers that come in. And we're currently sitting at 4.5 on that scale. So 0 being not ready at all and 10 being fully prepared. We're now at a 4.9 at the moment.
Great. Okay, we'll just give it a moment longer for everyone else to put their response in. Have we got any more coming through, Chris?
We've had a couple more come through yet. So we've had 9 click and answer that for us, and we're at 4.8 at the moment.
Great.
As Matt said, I'll share this with you at the end so you can see the final results from this and the next question.
Great, thanks very much. Right, let's move on then. So what do you need to consider then when you're adopting an AI strategy? So I think we see within Redmore, we have a framework where we consider 5 key success factors. First of all, it's defining a clear NHS-aligned AI governance approach. So that includes making sure you've got the right team in place across the ICB. You've got the right processes that you're communicating effectively to stakeholders across primary care. You have got the right methodology for reviewing AI solutions, and also providing that communication and regular review period to optimize and update primary care organisations over time. And that's considering, the clinical safety aspect, the data governance side, the legal implications, and also the communication aspects as well. I think another key factor is really that market scanning and requirements gathering exercise. It's really understanding, what does AI in primary care mean? What are all these different use cases? What solutions are out there? What's working right now within your patch? So a lot of practices are actually already adopting their own AI solutions. So it's actually really keeping your ears to the ground and understanding what your area is currently using. Also looking more widely at the NHS. And what's working well across different pilots, so that you're not missing the boat with some potential good ideas. And then it's really key to factor in that sort of deployment model. So making sure that you're managing pilots effectively to manage the the success and the applicability of different solutions, making sure that you're then capturing the right quantifiable benefits, the unquantifiable benefits that you can then use them for business cases for wider rollouts. And then factoring in that change management as well. Whenever you introduce a new technology, you've always got to factor that primary care staff are very busy, so you need to factor in that budget for training, for appropriate usage of AI for that use case, and supporting adoption down the line. And AI is constantly moving. It is there's constantly new solutions that are coming out, new functionality within existing solutions. So that sort of ongoing performance tracking and optimization is going to be absolutely key, because we're going to see so much change in AI over the next few years. So some things you need to think about, so there's like a checklist. So this is sort of conversations that we're having, we're supporting ICBs with these plans. I would encourage ICBs to really identify and prioritise the use cases that are most important locally and across the NHS that are working well. So you can focus your time and your efforts on the areas that are going to make the most difference. Understand what different suppliers are out there across all these different use cases, and also understand what's actually working well within your area. So doing those surveys, doing those engagement sessions with practices, maybe there's local GPTs that are being used that are working well. Maybe there's an RPA or an ambient scribe solution that's actually working well within a few PCNs in your area. It's really capturing that data so that you can encourage a wider rollout and appropriate use of the tech as well. It's establishing that dedicated AI governance team, developing a governance framework. I would encourage areas not just to develop, a very dry, dense AI governance framework, but also support that with a practice-facing document that very clearly explains to practices in a digestible and easy to understand way what they need to consider around AI. So that education piece to make sure that you give the confidence to primary care staff on when it's okay to use AI, how they should use it, and when they need to be wary and when they need to speak up to the ICB. Being really clear on that and providing really good resources can make a lot of difference. Running structured pilots should definitely be a priority around those identified use cases that you want to focus on. Setting really clear success criteria, and then ensuring that ongoing monitoring and evaluation as well. So next question on the Menti is, what aspect of AI readiness do you think your ICB need to prioritise? So we know ICBs are all in sort of different places around this. So it'd be interesting to know what you think your ICB in particular needs to focus on.
Okay, that question should be up for everybody now. It's a word cloud, so just put in a word or a phrase that fits, and I'll read any out that come through at this point.
Right, just give it like a minute for everyone.
Not had anything come through at the moment, so if you are using your smartphone, you can scan that QR code on the screen again. We've had a couple come through, so confidence, governance, clarity, education, value for money, getting some really good answers here, so thank you very much.
Great. Let's give an extra 20 seconds.
Really good ones just come through. Lessons learned, really important.
Okay, I'll move on, but yeah, keep the answers coming through as I talk through, and we'll go through at the end. So like I mentioned, AI solutions are evolving rapidly. It is a really fast-changing area. I think a lot of the digital changes that we're going to see in the NHS the next few years are going to be heavily AI-led, and we're going to see more change in technology than we've ever seen before. This is affecting us not just in the NHS, but generally in society, isn't it? So we need to get around that fact that there's going to be a lot of change and it's going to be moving fast. And an iterative approach is going to be really key. So, doing that market scanning, doing the benchmarking, evaluating suppliers, doing the procurement, and constantly being in that loop. So not just treating it like, okay, I've reviewed that, we'll move on. You need to be constantly looking at what's working, what's improving, and what's changing. And that's really key to how we're approaching that that agile approach with the ICBs that we're working with. So like I mentioned, we're working with a number of ICBs to support teams, and this is really about working in collaboration with ICB teams. It's about helping to set up the methodology and the approach and the program management platform for how you'll develop an AI strategy. And it really comes down to those 5 pillars. So it's really nailing down the policy and the governance side, making sure it's crystal clear what your processes are, what your methodology and prioritization approaches are, and what your communication levels are between the ICB and primary care organisations. It's then about building up your skills in terms of knowing what's going on in the market, what suppliers are out there, what areas do you want to prioritise, managing those pilots effectively, getting your training and adoption right, because this is going to be a big thing for practices in terms of actually making sure that the change management, the embedding of the tech is done right, because that's the difference between a successful implementation and just a tech that sits on the shelf and doesn't achieve those benefits. So the training and adoption is really, really key. And then finally, that iterative performance and impact measurement as well. So we'll move on to Q&A now. And if anyone offline wants to get in touch with us around looking for some support around developing their AI strategy or getting things going or want some information, we can absolutely pick up offline too. But yeah, I think for now we'll open up to questions.
So I've given access to everybody to have their microphones and their cameras. If you've got a camera, it'd be lovely to see your faces rather than just your initial, but please feel free to speak up and ask any questions. Just while we do that, I'm going to just share the word cloud for you so you can see some of those answers that came through.
If you want to add the questions in the chat as well, feel free. William, you've got a question?
Yeah, I'll go first, and hopefully this isn't out of turn, but really good presentation. I just trying to get my head around the ICB's role in all of this in terms of the solutions that practices are using, because we're not necessarily purchasing or commissioning these services, but we're being asked to do the governance and the assurance around it. Is that what from your perspective, that's how we should be approaching this? Because I think that's going to give us quite massive resource implications and also kind of stifle innovation, rather than if on the flip side it's for us to provide this guidance to enable and empower practices to do that assurance process themselves. That's probably a little bit easier from us and a better message to push out. But then again, there isn't those specialist roles necessarily within the practices to do that. So it's a bit of a catch-22.
Yeah, I think it's a roadmap. I think, at this stage, definitely that getting the governance right and providing that guidance to primary care organisations is definitely, I think, the first step. I think down the line, probably, ICB-wide procurements are going to be the way to go. If you're identifying that some products are just working very well and the benefits are compelling, if you can roll it out wider, you can then look at, and if you're doing this pilots well, it sets you up, doesn't it, to do those ICB-wide procurements. But I agree with you, get the governance seems to me that the first step they need to be focusing on. And as well, actually, in terms of toolkits. So I think providing that guidance via like a practice-facing toolkit, I would see as providing real benefit to practices, so they know the do's and the don'ts of adopting AI and all that sort of thing. I think that's a key thing that ICB should be looking at.
Yeah, thank you.
Kerry?
Got another question, Kerry? Go for it.
Yeah. Hi, everyone. So I'm coming at this as part of the regional team in NHS England, and the comms that you put up was the comms that we pushed the national team to provide to ICBs, because this is a really difficult situation for ICBs, given that practices are using AI, they are using RPA. We've got no national framework at NHS England level which supports ICBs in procuring products that are safe for use in the NHS. So we're putting ICBs in a very difficult position as it stands at the minute. We know that the national team are looking at that and are genuinely trying to move that forward. But in the absence of that, we've got a situation where practices are using it. Precisely the point that's just been made, we're asking ICBs to put some kind of governance and assurance around this when they may not have the skills to do it. and we haven't got a clear national policy line on its use. So it's really difficult because ICBs are stuck in the middle, and actually invariably they're not funding them because they can't afford to fund them, because we know that money is very, very tight, and going into 25, 26 particularly, there is an ask on ICBs to fund existing digital tools, online consultations, demand capacity, etc. So to fund RPA and AI is just not going to be an option for ICBs into 25, 26. So it's a difficult one because all parts of the system are not quite connecting on this at the minute, but recognising that it's out there, we need to do something about it, and we need to make sure that these products are safely used in an NHS environment. And at the minute, we can't give that assurance. And I think going back to the strategy piece, I think that's really useful. I think for me, we'd probably look for, what is the ICB digital primary care strategy? So what are they actually looking at doing across the whole of digital primary care? And then where does AI and RPA sit within that? So rather than having something separate, you would have a digital strategy, and then you'd look at use of these tools within that, and then how you're going to support them as an ICB going forward. And I think the other thing for me is, when you're looking at digital, what's the problem that you're trying to solve? And can digital help and enable? And I think that's the other bit that we kind of almost need to go back to. What is it that we need to do in primary care, and do those existing tools that are already funded do that or not? And if not, can AI or RPA do it? And I think that's the bit for me that we need to be squaring off some of this, and we're not quite in that place yet, but recognise that it's being used. So a difficult one.
Yeah. Matt?
Thank you, Kerry. Matt, go for it.
I was just gonna add, hi Kerry. The national team, the NHS England national team, said that there is a sort of national policy and guidance due imminently. I wonder if at an ICB level there are sort of different challenges to deal with. One of the first ones being to put some governance around what's already going on, because you can be pretty sure that within every ICB there's going to be some element of AI technology that's already being deployed, whatever that looks like. It could be a scribe, it could be scribe technology, it could be RPA. Even just making people aware of their responsibilities from a clinical safety point of view, from an ethical point of view, from a legal point of view, might be a good first step that might not take a load of resources, to go back to the earlier question, to just give some confidence and some assurance that what the status is under control at the moment, or at least you are trying to address some of the governance of that existing point. Then there is, how do you deal with new technologies that are going to be deployed or are going to be introduced to the market? But I think for many, it's sort of, how do we get some semblance of control of what's already out there? I certainly occupying quite a few of the conversations we're having in the programs we're having at ICB level is, how do you take stock of where we are now?
Yeah, definitely a good point, Matt. Anyone got any other questions or comments?
Yeah. Any other questions? I just noticed as well, there's been a couple of messages put in the chat around that AI. It's in the comms that you mentioned, Kerry, that's been sent out from the centre. A couple of people mentioning that they've
I think
not
it
seen
went
that
out to the regional,
to.
Regional digital primary care lead. So it was for them to disseminate to their ICBs. I'm not quite sure, Alicia, or Claire, which IC. Oh, you'd be Northwest, are you? Northwest region.
Okay. Great. Well,
Thank
if no
you.
one's got any other questions, I think we can leave it here. But like I mentioned, if anyone wants to reach us after the session, got any questions, or want to call around sort of, want to brainstorm what they can do around their ICB, around AI, please get in touch. But no, thank you everyone for your time. Really appreciate it.
Thank you, everybody. Appreciate your time.
Thank
Give you
you.
some of your day back.